All right, this is my recording for the thermal agents video. And right now our patient is probably in the end part of the fibroblastic phase, heading into the remodeling phase. And they've just finished up a bunch of exercises. We started their treatment with a hot pack in order to get everything nice and extensible, but now they have a little bit of extra swelling, so we're gonna apply a cold pack. Some precautions and contraindications for this, or rather indications to begin, is you have an acute injury or inflammation. It can also help with muscle spasm, swelling, spasticity, and in some cases it can help with first-degree burns, pain associated with that. But in terms of precautions, we want to watch out for neuropathy, any open wounds or Raynaud's disease, vascular insufficiency or lack of sensation around the area, pregnancy, or a high sensitivity to cold. Okay, so we're going to get right into it. Hey Connor, how are you doing?
Going good.
Good. Okay, so I noticed there's a little bit of extra swelling after doing all those exercises. So what I'm thinking we do is we apply a cold pack for about 15 to 20 minutes just to reduce some of that swelling. What the cold pack does is it creates a vasoconstriction, so it reduces the size of some of the vasculature in that area and will help with reduce some of that swelling and also decrease some of the pain associated with that acute activity that you just did.
Okay.
Is that all right? We go ahead and do that?
Yeah, let's do it.
Okay, cool. So right now I'm going to inspect the skin. Everything looks good. It's just a little bit swollen. And I'm just going to go ahead and apply the ice pack. I'm going to have you hold this and kind of... We have a cold pack inside of this pillow sheet right here. And if it were ice, we could just apply it directly to the skin, but because this is a cold pack, it can actually create some burns. And so that's why we have at least one layer of insulation here. And all I'm going to do is I'm going to apply it right here. Okay, normally I would use an elastic band or something like an ACE bandage. This is all I have right now, and this should actually work pretty well. So we want to apply a little bit of compression along with the cold so that it can penetrate a little bit more deeply. And so let me just know if anything is uncomfortable here. All right, Connor?
Yep.
Kind of spread this out to get more contact area here. We just want it to be nice and evenly distributed across the ice pack. We can tuck that underneath. All right, so we're gonna leave that on for about 15-20 minutes. Okay, I'm gonna leave you with this bell here. And what you should feel is just a nice, comfortable amount of cold. Okay, if it becomes uncomfortable at any time, go ahead and ring that bell or just get my attention any way you need. If it becomes really uncomfortable and you just need to take it off, you can go ahead and do that. Okay? And I'm gonna set this timer and I'll come check on you in about 5 minutes.
Okay.
Okay? Okay, so it's been about 15 minutes. I'm gonna go ahead and remove this from Connor, okay? Connor, how did that feel?
Feels good. My knee's
Yeah?
bent up now.
Okay. All right, so inspecting here, looks like the swelling's gone down a little bit, and everything feels all right?
Yeah, it feels a lot better.
Excellent. Okay. Well, that's the end of our treatment, and I guess give us a call if you need anything, and we'll see you next week.
Okay.